You've been suffering from back or leg pain, you could have a herniated disc.
When it comes to treatment, you want something that's minimally invasive with faster recovery and less muscle damage. Well, our next guest is here to educate us.
Yeah, tell us a little bit. Orthopedic spine surgeon Pedro Ricard of Miller Orthopedic. Good to see you, doctor. Thanks for coming in.
Good to see you.
First off, give us some of your background, because you just told us you're new to the Omaha area, so it's good to have you in Omaha.
Yeah, thanks for having me. Yeah, I was born in Dominican Republic. I moved to New York for residency training. And I just finished my spine fellowship in Michigan. Okay. So I'm fresh in Omaha.
Only about a month, right?
Yeah, roughly a month.
Very new.
Welcome to Omaha.
Yeah, welcome.
Thank you.
So let's dive into the topic. What is a lumbar disc herniation?
So I'm a spine specialist. Your spine basically is blocks. So those blocks are called vertebrae. So if you have a picture, in between each vertebra there's a disc. So that disc is kind of like a donut. The outer shell is tougher, and the inner is like a gel.
Yeah.
So if you go to the next picture, a herniated disc basically, the other picture, sorry.
Oh, there we go.
There we go, yeah.
That's it, yeah.
So if you can see on that one, you see how the gel kind of is extruding?
Yeah, it's coming out. It's
so there's a break in what's called the annulus. So that tougher part breaks and that gel comes out. What causes, that's like a mass effect. So it pinches your nerve. So that's what they call a pinched nerve.
Yeah.
It doesn't seem like that'd be very comfortable.
That is not very comfortable.
How painful can this be in some people?
It varies, actually. You can have a very big herniation and someone's walking and has no complaint whatsoever, versus someone has a very small one and it's just driving them crazy.
Why is it? Is that just depending on where it's pinching a nerve, or why is there
Correct.
some pain?
It's a very sensitive tissue. Nerves are different in every person, and depending on where it pinches and how it pinches, it varies. Now, that being said, you get an MRI in 100 people and you're going to find disc bulges. Now, that doesn't mean everybody needs some type of procedure. It's normal for aging and stuff like that.
Right.
But as what we're more interested in, the ones that become symptomatic, and that's where your leg pain kicks in or your back pain.
Now, what are the risk factors, especially if you don't get this treated?
So the biggest risk factor is nerve damage. So one of the presentations, if you have motor or sensory weakness, this is kind of like when you're in the bathroom for too long and you stand up and everything's numb and you feel like ants crawling up your legs. That kind of numbness could be there forever. At the same time, you could lose, depending on which nerve is pinched, the muscles could not work.
Yeah, what do you do? So what do you do to treat something like that?
So the principle is take that piece out. Now, it's called, what we'll talk today about is microdiskectomy. Microdiskectomy has been around since the 70s. So
I've got friends that have had that, yeah.
Exactly, so it's not a new procedure. What's new is the approach to it. So the minimally invasive procedure to it has evolved. Now we have what's called tube microdiscectomy, as well as endoscopic and camera. So it has evolved. So the key in minimally invasive surgery is to decrease the damage to the soft tissue. So as opposed to having a big incision and taking those muscles off your back in order to get to your spine, you make a smaller incision, put a tube, which is roughly 8 millimeters in terms of radius, and you get access to a specific spot and try to get that herniated disc out.
Now let's talk recovery time. What is that like after?
So this type of procedure is actually done in an elective setting. So you have surgery in the morning and you're home in the afternoon.
Oh, nice.
Now, that being said, the minimally invasive potential benefits is less damage, less blood loss, and faster recovery.
I think there's risks to everything, aren't there? So what are the risks of a procedure like this?
So the risks for the microdiscectomies are exactly the same as open. So you have dural tears, infections, and reherniations are probably the most common, but they're not any different than if you have a normal procedure.
Yeah. But I'm sorry, go ahead.
Oh, no. Well, I was just saying, what are the advantages of this as well?
So again, it's the faster recovery, the potential for faster recovery, less pain in the post-op, and people tend to appreciate the elective nature of it.
And the results, are the results guaranteed if you do a procedure like this, or what type of impact and relief are patients seeing?
So one thing to remember is, one, not everybody's a candidate. Two, is everybody should undergo conservative or non-operative management before this.
Right.
If you fail that, then you're a candidate. Now
I'm sorry, I don't mean to cut you off, but you want to try to do whatever you can
Correct.
to improve your condition before you get to this point of this procedure.
Usually recommending is physical therapy, injections, some people like massages. So a lot of things we try for at least 6 weeks. After that, if the symptoms worsen or haven't improved, then when you talk to your doctor, you kind of have options. So sorry, going back to your question.
Yeah, no, you answered my question, but the one thing that you brought up that I didn't get it, I wasn't clear on was who makes a good candidate for this? Because you said there are different types of candidates.
Yes, so ideally the best candidate for this is a person that failed conservative management and is primarily leg pain. Yeah. So there's a million causes of back pain. This can cause back pain, but when you have a procedure like this, we can take away the leg pain. The back pain is not guaranteed because there's other reasons why you could be having that.
I've had some back pain. Well, I've had some back issues that led to severe pain down my leg, and that can be debilitating.
Yes.
So people will do whatever they can to get that done. How should patients find you? Because you do other conditions. You treat the spine.
Yes. So basically,
well.
yeah, spine in terms of deformity, tumors, trauma, degenerative, everything in the neck and the lower back. Miller Orthopedics has clinics in Omaha and Council Bluffs, and I'll also be visiting the outreach clinics in Clarinda and Audubon. So.
Right, and the website I believe was millerortho.com for more information.
Yeah. And there's clinics on both sides. You got Omaha Clinic and the Council Bluffs Clinic. And if you have questions about anything we talked about, we just scratched the surface on a lot of this stuff.
Yes, yes.
If you have questions, just give them a call. Stop in for a consult. The phone number's right there on the screen. Doctor, welcome to Omaha.
Thank you. Welcome.
Informative interview this morning. We appreciate it.
Thank you so much.